Thank you very much and good afternoon. For today, for our update, we are reporting 911 newly diagnosed cases of COVID-19 in the province, including 4 epidemiologically linked cases, bringing our total number of diagnosed cases in the province to 30,884. This is 153 people in Vancouver Coastal Health Region, 649 people in the Fraser Health Region, 27 people in the Vancouver Island Health Region, 47 people in the Interior Health Region, and 35 people in Northern Health. We now have 301 people in hospital across the province, 69 of whom are in critical care or ICU. And sadly, again today, we have 11 new deaths to report, bringing the total number of people in our province who've died from COVID-19 to 395. And the vast majority of these people were people in their 70s and 80s, our seniors, our elders, grandparents, spouses, family members. And I know there are 11 additional families out there who are grieving today, and we send our condolences to them, to their care providers, and most of the cases today were also people who are living in long-term care, and we know how challenging that has been this last year. We now have 10,430 people who are under public health monitoring and 21,304 who have recovered from COVID-19. We also have 3 new healthcare outbreaks at the German-Canadian Benevolence Society Home, Villa Cathay and Morgan Place Care Home. And 1 outbreak has been declared over at the Peace Portal Seniors Village. That leaves us with 59 active outbreaks in our healthcare system, 54 in long-term care and assisted living, and 5 in acute care, involving 1,162 people, 718 residents, and 434 staff who are active cases at this time. I just wanted to remind everybody, as we have these large numbers of people who are being diagnosed in our province and under active monitoring, that as part of our contact tracing efforts, teams are working to identify if there's an outbreak or not. Public health teams may conduct or may ask and offer widespread testing of people, whether symptomatic or asymptomatic, in settings like workplaces, like schools, and long-term care homes, even if there's not widespread community transmission in that area. And the priority is to contact those who are positive first to make sure that people are isolating. So there may be a delay in people getting results in some cases if they're negative in these outbreak investigations. I've received quite a lot of, I guess I want to make one more comment about some of our data that we'll be reporting later today. The number of new cases, as we know, is one of those numbers that we all look at very carefully every day and pay close attention to. But equally important for us is, of course, the percentage positive of those who have been tested for COVID-19. Until recently, we have taken a holistic approach in that we include all testing that was done of everybody in the province and report the percent positives of those. This includes what we call testing under MSP funding, so people who have a billing number, and also non-MSP funding. And much of that is people who are tested for other reasons. It may be federal populations, for example, penitentiary, correctional officers, and other federal populations, including First Nations in BC. And as well, we know many of these tests are for travel, for sport, or for because they're required in industry. As our cases and our surge has increased here in BC, we've seen a difference in the percent positive between these two groups these two testing groups. Under MSP, our testing approach, as you know, has been to test people with symptoms, and the percentage, of course, is higher because in many cases we are case finding, particularly in a case of a cluster or an outbreak in a setting like long-term care or a workplace. The non-MSP tests include mostly people who are asymptomatic, although there are as well some related to investigations in clusters. And often there are people who are being tested multiple times for work or for travel. As a result, over the last few weeks, the difference in the percent positive in those two groups has been considerable. And now we're going to, with those getting tested multiple times in the lower non-MSP risk group, the percentage is quite a bit lower. Our weekly BC situation report, which comes out on Friday afternoons, will now show both of these, the MSP, the total, and the non-MSP, so that everybody can see what we have been looking at on a local level and the differences between those two groups. And that more accurately reflects some of the community transmission that we are seeing across the province.